Hello, hello. All right. So while I wait for some people to come in, gonna hang out here. Oop, some people are already making their way onto the live. So while I wait for people to make their way in and start leaving questions, I will introduce myself, and I'll probably introduce myself again in a little bit for the people who come on later. But my name is Elise Petronzio. Octopus, which is the handle that you see down there, which is an OCD advocacy and recovery shop. Working with no OCD, they do amazing work, and I'm so honored that they allow me to be a part of these lives for them, and I get to advocate in this super fun way, and I get to meet all of you, and I love getting to know people in this OCD community. I see someone says their first live, welcome. So yeah, the way that it would work is you just drop whatever questions you have in the comments, and I can see them, and we'll go through them one by one. We'll do this for around 45 minutes. And I'm pretty open about my OCD story, so feel free to ask me anything. But yeah, so I've had OCD since I was showing symptoms by the time I was 6, and then by the time I was 9, it was pretty severe. And then I had to get help because I was having a lot of trouble functioning. And then I've had it on and off the way OCD does wax and wane. I've had it on and off, all different themes since then, and now I'm 24. So, but it is a really big reason why I advocate. I'm not sure I'd ever be an OCD advocate if I didn't have OCD in the first place. So it's given as much as it's taken is what I usually say. But yeah, feel free to leave me some questions. I see we have a good amount of people on here, but I'd love to hear what you want to talk about tonight. How's everybody doing? We made it to Thursday. Let's see. Okay, we have a question. How do I help with inappropriate staring OCD where I'm afraid to hang out with friends because if my eyes look at them that way, if my eyes look at them that way when I don't think of them this way? Okay, let's see. So this is not something I personally have had experience with, but I know that I just saw someone talking about this. So it was either NoCD that posted something about OCD staring, or it was the IOCDF, the International OCD Foundation. So you may be able to check them out. I would look around. I have seen things about OCD staring. Unfortunately, I don't have experience with that, but it's something that a lot of people do experience, so I know that there's got to be a way through it. Let's see. Someone discovered they had OCD last year. I'm glad that you figured it out and that you've made it to resources. Sometimes that can be one of the most difficult parts. You can figure out that there's something wrong, but you don't know how to get help until way later, which is something that OCD is changing, luckily. And then someone asked, do you take medication? I do take medication. I didn't take medication for the first, well, I was going to say 18 years of my life, which is true, but I didn't take medication as a child. My parents did not want that for me, and my case didn't warrant it at the time. And I do take medication now, though. It's a very important tool that I use. It's definitely a personal decision, though, but I'm very happy that I'm on it. And I had a lot of OCD surrounding going on it, too, so that can be really difficult. Okay, and then let's see. Oh, this is nice. I can show the question so people can see it. So it says, how do you stop ruminating? So this is a great question, one that I am working on all the time. I think one thing that's important the most important thing is to notice that you're doing it, because a lot of times with rumination, people don't even notice that they're doing it. And that's what keeps them doing it for so long. So first you have to notice. And then once you notice, you have to choose to try to change what you're paying attention to. So, for example, it's like if I'm ruminating about a decision I've made, which I do often, it's actively deciding, no, I'm going to pay attention to this instead. I'm going to pay attention to what my family is saying to me instead, or something like that. But really, just getting into the habit of noticing when you're ruminating is really important in it. So that's a really big step. All right. How to handle an OCD flare up. Let's see. Well, definitely, if you have treatment resources or need treatment resources, that's a great time to get in touch with a therapist if you had one in the past, or to find one if you don't currently have one. It's a great way or a great opportunity to check in with some sort of treatment provider. You could go to a support group. Yeah, I would really say that if you have already gone through treatment, to revisit those skills would be a good thing to do to handle the flare up, but also just like trying to be patient with yourself. It can be really frustrating to have a flare up if you have been feeling more well in like the weeks before it. So I think that's really important too. How do you let your OCD thought not stick? How can I let them go? Also, do you handle social anxiety and contamination OCD? So about letting your OCD thought not stick and how can you let them go? So let's see. Also, I wouldn't be here if I didn't struggle with these things too. So sometimes it takes me a second to think about what I want to say, which everyone will have to be okay with. I feel like worrying about if it's going to stick or not can actually just increase anxiety. Again, I think going back to what I said about rumination, what helps me when I'm trying not to have an OCD thought stick is I try to embrace the fact that it's coming up and remember that I can't control my thoughts. I can only control my actions. So the thought might come up, but I'll just keep putting in effort to try to turn my attention to something I value instead. Or you can do an exposure if it keeps coming back, where you do sit with it and you don't try to make it go away. Because it's like, I understand you wanting to let them go, but if you're trying hard to let them go, that I feel like that can almost be seen as trying to push them out, which doesn't work with OCD. Once you become really comfortable with having the thought is when the thought will happen less, which is difficult but true. And how do I handle social anxiety and contamination OCD? For social anxiety, for me, it definitely is a lot about not avoiding social situations. I've noticed that the social anxiety does tend to get a lot worse when you start avoiding things. And then for contamination OCD, this is not a subtype that I struggle with a lot, but I can tell sometimes I could be on the border of struggling with that. So I just expose myself to what I feel contaminates me and then don't try to wash my hands or do anything to get rid of it. Let's see. Lots of questions now. Okay. Are you able to tell me about the link between OCD and autism? Are they often comorbid, etc.? So I don't want to say too much about this because I don't know as much as I would like to. I definitely know that it is a common comorbidity. It's something that is talked about a lot in OCD spaces and autism spaces. I would definitely look into that more, but I have seen people talk about both. I just don't personally have enough experience to speak to that. What would my obsession with my heart rate be called? I am always so worried when I don't feel that my heart rate is as slow that I want it to be. Yeah, so I've definitely obsessed over my heart rate before. I think that can kind of fall under health anxiety or even maybe sensory motor, but I'm not totally sure about that. Also, just for anyone who hopped on later, because there's a lot more of you now, I am an individual with OCD. I'm not a therapist, so I'm just an OCD advocate. I'm in this with you, so I definitely get what you're going through. But yeah, so more technical questions about subtypes might be harder for me to answer. But you're free to ask, and I'll let you know if I can't answer it. Yeah, I would say it sounds more just like general health anxiety. Some people say health OCD. Yeah. Okay. Right now, I feel really disappointed that my HOCD is back. My relationship ended, and now I feel like since it doesn't have ROCD to sit with, it switched back to HOCD. It's absolutely maddening. Yeah, it's really, really difficult when it changes themes because you think that you're going to have relief when a theme ends, but then actually it just turns into something else. So I can definitely relate to that. And I think that this person is probably referring to HOCD, meaning homosexual OCD. More recently, people call that sexual orientation OCD because it can happen to people of many different sexual orientations, not just people being afraid of homosexuality or being homosexual, I should say. But yeah, I've had one theme kind of wrap up and then suddenly a different theme gets all the attention. It always made me feel a little bit like my themes didn't have as much power as I thought because I could only have one theme at a time. And I was like, well, why does this suddenly not matter to you anymore? So obviously it was not that dire in the first place if now we're just able to let it go for something else. But that's just me kind of joking with the OCD, but that's a hard experience. What kind of medication do you take or do you find helps you? I'm still trying to find one good for me. So I do know that a lot of people with OCD take SSRIs. That's the class of drug that a lot of people do take, but then there are people that take other things as well. So really working with a trained professional, a psychiatrist, to help you get medication is the best way to go. But I do take an SSRI and I have taken them before. How do I help with my OCD flaring up during PMS? So I do hear a lot of people talk about this. It's not something I personally experience, so it is a little hard for me to give advice on. I would say similar to an OCD flare, getting in touch with anyone on your treatment team, your therapist, any tools that you've learned through therapy would just be really important to use those tools during any kind of OCD flare-up, no matter what it's caused by. Let's see. Okay. I have had OCD for years and take medication for it. It helps for the intrusive thoughts not to stick, although they do pop in and out. How do you forgive yourself for those intrusive thoughts? So I do remember, so also some people came on later. I've had OCD since I was 6. I started showing signs of compulsions. So I've had a lot of different feelings throughout the process, and I used to have a lot of shame around certain intrusive thoughts, especially the more taboo intrusive thoughts like sexual content, harm content, etc. I feel very desensitized to them by now. I think what's helped me forgiven them was realizing that they are just thoughts and you can't control your thoughts. You can only control your behavior. So I think remembering that it's not something you have control over, and when you can't control something, then I don't think you really want to feel shame for something if you can't control it. But I was thinking at the same time, I have a lot of trouble still with not feeling shame over certain emotions. So I definitely can relate to the struggle of trying not to blame yourself for something you can't control. It took a long time, but I guess just for trying to keep that in mind, that this is not your personal choice to think these things. So why punish yourself for something that you're not choosing to do? False memory tips. How do you disregard or accept the worst when your mind literally makes up memories and images that could be true? So Again, this is not something I personally experience, so it is a little hard for me to give advice on it. How do you disregard or accept the worst when your mind makes things? Yeah, it can be really hard to move past things that your mind thinks of when it feels really important that you have to solve it. So it's really hard. That sounds like a really difficult experience. I saw a meme on a very popular OCD therapist, John Hirschfield. His practice put up a meme that it was about hit and run OCD, and it was like, if they're dead, they're dead. Like that was like the response, because the idea that you're just supposed to move on and drive away as if you're not worried that someone is there, like behind you, that you may run someone over. Yeah, that could be really tough. I would definitely speak to your therapist about that if you're having a lot of trouble with that. But I do know with everything, all OCD sessions feel really important, and treating them as less important is the way to get past it. It's really hard to do, but you do it by practicing through ERP. So I hope that helps. Oop, I lost my spot. Okay, here we go. Do you know of any great resources for therapists that don't prescribe medicine? So I don't totally understand this question. I can't tell if this is a therapist or someone with OCD writing this, but if it's a therapist looking for resources because they don't prescribe medication, I know the IOCDF has different resources for medication on their website for OCD. So that might be a good place to start. If you are an individual looking for a therapist that doesn't prescribe medication, I'm digging into my psychology background here. As long as you're not going to a psychiatrist, they can't prescribe medication to you. So like a counselor, a psychologist, a licensed social worker, none of them, they would all be giving different types of therapy like CBT, hopefully ERP, but they wouldn't prescribe medication. So, and also if you're concerned about maybe finding a therapist who's not going to pressure you into medication, I know that was something I was concerned about. Not sure if that's also something that you mean here. I would set that boundary in the beginning when you meet with a new therapist that you're not interested in medication and you're not open to talking about it. My job involves meeting people a lot. I often make bad assumptions or have sexual, racial, etc. thoughts. Any tips? So this is, I give you props for commenting this, because I know some people get very anxious admitting like the kinds of thoughts they have. I've seen a lot of people say different things about this, but it all comes back to the idea that we don't control our thoughts, we control our actions. So you can have as many bad, negative thoughts about people, but what really matters is how you respond to those thoughts. A lot of thoughts are very automatic. You don't get to control them. So I would say to remember that the focus is on your behavior. So if you're treating somebody differently based on the assumption that you heard in your head, then that is something that you can focus on more than what thoughts come into your head, because you're not going to be able to stop bad thoughts from coming into your head. Yeah, so I wouldn't, you're having thoughts about people. A lot of people have bad thoughts about people. I know I have. Like, I think sometimes I have really mean assumptions in my head about people when I meet them, but my brain just thinks it up and I'm like, oh, that's interesting. And then I continue getting to know the person myself. Does false memory OCD include things that may have happened to you, not just what you might have done? I would have to say probably. I think false memory OCD can span basically anything. So I would expect that it probably could. how do I deal with OCD thoughts that everybody hates me? If anyone knows, let me know. But yeah, it's the same thing. I think it's just recognizing that thoughts are not facts, and just because your brain has thought it doesn't make it true. It can definitely be very uncomfortable to think that everybody hates you, but I think just trying to remember that that doesn't mean that's necessarily happening. And that's really important to remember, that your brain is going to say random things to you that aren't necessarily true. So you don't want to act on every thought you have as if it's telling the truth. How about unwanted sexual thoughts and feelings? I think that's very similar to what I just said. You can't control your thoughts. I haven't said that you can't control your feelings as much, but actually, no, I did say that at one point. But yeah, you can't control your feelings either. So what matters is your actions, and that's the only thing we can control. And if you're having unwanted sexual thoughts and feelings, the more comfortable you get with having them, the less frequently you actually may have them. So the more you fight them, the more they're going to stick around. I just wanted to show this quick. I think the heart rate thing is somatic OCD. Yes, that does sound possible. I'm not super familiar with that subtype, but it sounds like it could be right. All right, let's see. What advice / inspiration do you have for us from your own journey? I think, let's see. I'm like looking at my hair. I think that some advice I have would be that almost all flares come to an end at some point, which is nice. We can't control our thoughts and feelings. We can only control our behavior, which I feel like I've said a lot. Yeah. I really have become desensitized to a lot of different themes I've had. It just takes time and it runs its course. So just trying to stick with whatever you want to do values wise, and don't let the OCD run your life. You should run your life, which can be really, really difficult. I'm looking for all the help I can get right now, just having intense obsessions and having a hard time I think the word is staving off the compulsions. Please help. So I'm sorry to hear that you're struggling so much. My suggestion would definitely be a really great thing to check out would be NoCD's free support groups. You don't have to be signed up through their therapy program in order to take part in them. And they really run almost every day, I'm pretty sure. So you should definitely check that out. And if you're not currently in therapy, I would try to get into that, and you can give NoCD a call by going to their website and seeing their phone number. Do you know if it's OCD when I stress over things people say about me? I often feel like the slightest criticism or rejection is the same as, what have you done? What's wrong with you, idiot? I'm trying to think if that's OCD or not. I guess it could really be, because you could think, what if it's true, and start obsessing about that. But I can definitely relate to it, like just being very sensitive to how other people are acting. I think it's more about, what are you afraid of if that is what's happening? Like, what are you trying to avoid? Like, when you're afraid that someone is criticizing or rejecting you, if it gives you a lot of anxiety, I think that would be like the core fear that you would want to think about. Let's see. Remember to be kind to each other in the comments. We're all just trying to learn and help each other out. So we want everyone to feel welcome here. All right, let's see. And okay. What type of ERP exercises would be employed if you have symmetrical, precision, or perfectionism OCD, Would you leave things messy, or unorganized, crooked, or out of place? That sounds about right. Whatever you normally try to avoid by fixing it, that is what you would do for an exposure for that. So whatever makes you uncomfortable and you're trying to fix, you would leave it however it makes you uncomfortable. So if that means things being messy, unorganized, crooked, or out of place, then that is what it will have to be. You probably, if you're picturing that and it makes you feel like, I don't really like this, and you're probably on the right track. What I am dealing with are intrusive thoughts? How do I know which thoughts I am responsible for or not? So you don't know what thoughts you're responsible for. You're not really responsible for any thoughts. You don't have to patrol your thoughts. That's like kind of what OCD makes us feel like we have to do, that we need to be on guard for bad thoughts and keep them out or fix them or something. But really, learning to let all thoughts come and go is a big part of OCD treatment. And then this is an add-on, like, which thoughts am I responsible for? Not everything can be OCD. The thoughts that are about things that you value are the thoughts that you would want to take into consideration, which they're not necessarily driven by anxiety. So if you're like, I should go pick up, like, I need to get groceries today. Like, if you really need groceries and you don't have them in your house, and that's a thought you would want to pay attention to. But if your brain is like, I need groceries, and you just went grocery shopping, then you would know that that's not one you need to pay attention to because it's not rooted in logic, I guess. This could be tricky. This is a kind of a tricky question. Okay. And any recommendations for constantly checking your feelings about your relationships with others and about when something bad happens to other people? So this is very difficult, and checking your feelings is something that I've also struggled with. I think one thing is definitely turning your attention back to whatever is happening outside of your head, so that you have less time to check and not giving as much energy to the checking. Personally, I think it's really hard to stop yourself from checking initially, but you can choose to stop. Um, it's kind of difficult to say. I would definitely talk to your therapist about that too, but that's my personal view as someone who has experienced this myself. Um, you can always like change, kind of, I guess, like you can have an initial thought and then start ruminating, but you can't change the initial thought. So it's hard to get rid of that, but you can choose if you're going to keep re-engaging in it. So I think redirecting your attention is really important. Trying to read the next one. Why are people who suffer with OCD constantly told that it's our brain that is messing with us? It's my brain. I don't get the concept. I feel like when that is said, we are forced to disassociate the idea that our brain is ours. I don't know if I fully understand what you're saying, but I think the idea that it's like people make it sound like our brain is some other being from us. I don't know if that's what you mean. I think it is confusing because OCD does kind of feel like having two brains. That's how I've always felt. It's like having two different gut feelings and like voices in your head, voices of reason, etc. And one is OCD and one is the voice, the only voice you'd have in your head if you didn't have OCD, but they both have the same actual voice because it's all in your brain. So I think that may be what they mean. Like a lot of people talk about OCD like it's a separate thing in your brain because it's not you. I hope that helps. It's really confusing. OCD itself is just very confusing, so I get that. Okay. Hi, is it possible for OCD, in my case POCD, to affect the sex drive and one's general view on sex? I definitely think it can affect that. I know Chrissy Hodges, Pure O. Chrissy has spoken a lot about OCD and sex over on her YouTube channel. So that might be something you would want to check out. But I do know it can definitely change how you feel about sex. I've seen a lot of different talks and things about OCD and sex because it can really affect it. It's very hard to, like, sex in general and your sex drive rely a lot on being comfortable and present in the moment. OCD affects both of those things greatly. So I think that would make sense. Okay. How do I fix my phobia of going into large building, stores, and grocery? This sounds weird, but why does OCD not make sense and make you worry about things that aren't real? So I think one thing with working on phobias is exposing yourself gradually to whatever you're afraid of at a manageable level, usually with the help of a trained professional, like a therapist. Um, and I definitely OCD definitely doesn't make sense and makes people worry about illogical things. I don't totally know why, but it's just a misfiring in your brain about random things that don't necessarily make sense. My therapist used to say, like, your amygdala is going off, but it's like a false alarm. I guess it's just a very sensitive alarm. But that is the best answer I have on that. But it's definitely true that OCD does not make sense. It makes you worry about things that are not real. And I have actually made it to the bottom of all the questions, so I'm a little impressed by that. We still have about 15 minutes if anyone wanted to ask any other questions. Oh, okay, the name of the YouTube channel, hold on one second. So I don't know the actual name off the top of my head, but this is her name. So I would look into that. She talks about sex. She's definitely talked about sex and OCD before, and she's just a great OCD advocate in general. Yeah. Does anyone have any other questions? Oh, I do see another question. Also, if you have any questions about me, I'll probably reintroduce myself if there's a lull in questions. Does false memories also produce images? Again, I don't have false memory OCD, but I'd have to think it can, because OCD can produce images about things that have never happened, really upsetting images. So I feel like it definitely could. Let's see. And then I'll reintroduce myself while there's a lull in questions. But so I run an OCD advocacy and recovery shop called The Octopus, which is the handle that's here on the bottom. So we have different merch that's meant to empower people in their OCD recovery and also help advocate for what living with OCD is actually like. So we have different jewelry, stickers, apparel, things that remind you to embrace uncertainty and say maybe, maybe not to your thoughts. And also things that just tell people what living with OCD is actually like, because there's so much misrepresentation and misunderstanding about OCD. And let's see. Do you find that trauma can trigger OCD or intrusive thoughts? I would have to think that it probably could, because trauma makes you anxious, and when you are anxious, people tend to have more problems with OCD. So I would think yes. Okay. Someone also said how, but I wasn't totally sure what they were referring to. So if you could clarify. And then this one we have, could you walk through your profession through ERP? I'm beginning fairly soon. Hopefully you just want to know what to expect. And thank you. So I'm not totally sure what you mean by the profession. You may not have been here when I said that I am an OCD advocate. So I've been through ERP treatment, but I can tell you what that has been like. normally you get to know the therapist. They give you some educational background on OCD and ERP. Oh, progression. Okay, that makes sense. Yeah, so they give you some background. They learn more about how OCD is affecting your life, and then they help you create a hierarchy of different exposures you can do. So it'll be like things that are not as difficult. They still give you anxiety, but they're not really difficult to do. Usually you rate how much anxiety something gives you on a scale of 1 to 10, and some lower level exposures or situations that prompt anxiety will be at the bottom, and then you'll do those and you'll gradually move up as you're comfortable, well, not comfortable, but as you make your way through each exposure, and you do the exposures and try not to do compulsions afterwards. So hopefully that helped and made sense. All right. We still have a couple minutes if anyone has any other questions. This is my first time doing one of these lives alone, so I didn't realize how much I would have to talk and how quickly you go from each question to the next. But it's been fun. I talked to a close friend about my OCD, and at the time it helps, but sometimes later I end up with worse intrusive thoughts. Is it bad that I'm talking to this friend? So I don't know for sure whether or not if it's bad that you're talking to this friend, but what I do wonder, so I feel like a few things could be happening here where if you're talking about your OCD, it brings it up. I know that happens for me. Like if I'm talking about it, I'm not distracting myself from it as much. And in that case, it's like an exposure in a way because it's bringing it to your mind, which is an opportunity to not do compulsions and make the OCD smaller. So I don't think that would be a bad thing. But then there's also another thing that could be happening where you could be talking to your friend and confessing. So you could be like getting reassurance from your friend, and that in the long run would make your OCD worse because you'd be getting reassurance, and that's a compulsion, which makes your obsession stronger. And then that's how that would happen. So I think thinking about why you're talking to this friend and what you're getting out of it would be important if there's any compulsions involved. Okay. Oh, I'm like out of breath. Do you have any tips for those with pure O? I don't have a ton of compulsions unless ruminating is one. It is. I guess I'm the only one asking questions. No, you're not the only one, but I do appreciate your questions. Yes, ruminating is a compulsion. It's one that I have a big problem with. Yeah, I have. So pure O is kind of a term that people use to talk about when people have mainly mental compulsions rather than like physical compulsions that they can do for their OCD, or that not can do, that they feel like they have to do. So yeah, ruminating is definitely one. So trying to redirect your attention when you're ruminating is definitely a good tip for pure O. Yeah, that's a really big tip for pure O. Staying present in the moment makes it a lot harder to do compulsions when they're mental compulsions. So I would say trying to be present in the moment for sure. And then we have someone who said, hello, hello. A good let me show a question. Could you give a good definition of ruminating? Maybe like an example of OCD rumination? Let's see, what example do I want to use for this? So like I said, I run a business, and so I run a business. I have shirts that I sell, and I had to pick colors that I would want for the shirts. And I would spend way longer than someone without OCD would spend trying to figure out what colors I wanted, because I felt like I had to figure out which ones were the best. And after I made the decision, I would think about if that was the right decision. And I'd be like, well, this color is probably good because of this, which is like self-reassurance. Rumination is just like thinking about it for a really long time and thinking about it over and over. So I'd be like, did I do the right thing with those shirts? Like, should I have done something else? Maybe I should have done this. Maybe I should ask this person if they think I should have done these color shirts. And that would be rumination. Can OCD ever go away completely? So people have different views on what recovery and different experiences of what OCD recovery really feels like. OCD is a chronic illness, but some people really experience very little symptoms after successful treatment, which is really nice. But everyone's experience is different, so that's a very hard question to answer. I don't think it ever goes away completely, but it may not bother you. Do you think the lockdown and staying alone due to it is causing more cases of OCD? Mine started 4 months ago, and I found many in the community in the last few months. So I personally have had OCD most of my life, so I don't fall into that category, but that definitely can make sense. Being isolated and being in lockdown and not being able to go out and live your life is not positive for your mental health. So it's definitely a risk factor for mental illness and developing mental illness. So I definitely think that could be possible. If you had a predisposition for OCD, then it could be triggered by something really big, like not being able to go out and do things, and having to stay at home the way that many of us have had to and even do now. And yeah, so I think that's definitely possible. So hopefully that'll improve for people as things open up and as vaccines get more widely distributed around the world. How did you become an OCD advocate? I'd love to hopefully be one day. I'm sure they would love to have you. Personally, I have just connected with different people from OCD through my business, but I also know that if you go through their treatment, sometimes you're able to apply to be an advocate. Honestly, I would reach out to them if you're interested in being an advocate and see if they have any opportunities available. So never hurts to ask. We have someone who says they're trying to ask a question. Go ahead. I can see you saying, hi, I'm trying to ask a question. Can you see this? But I couldn't see anything before. And I saw someone else saying hello and then H, but I couldn't see it. Yeah, so go ahead. Okay. All right, I see. Okay, so we'll do 3 more questions. So we already have 2. So 1 more question after those. Okay. Sometimes when I'm making progress in one area of my OCD, I start getting in different intrusive thoughts, as if I've opened up space for them by not following through on other compulsions. Normal, definitely common to have different themes and jump around from theme to theme. I've heard that a lot. It's happened to me a lot. So definitely common for sure, which is frustrating, but just you treat them the same way as you treat the other themes. Okay, let's see. Let me get rid of that because the large questions like block me. All right, let's see. I just had this strange urge to break my eyeglasses, and it felt very similar to harm OCD. Feels like maybe because the glasses are fragile and vulnerable. It was an upsetting feeling. I'm afraid I might break them on purpose because Okay, I think the message kind of got cut off, but I do get the general sense. So this person had an urge or an impulse to break their glasses. So this is something, not specifically with glasses, but something I struggled with a lot with OCD is that urges and impulses can also be intrusive. And again, it's about not trying to figure out why they're there. And trying to figure out how to prevent them. It's about just accepting that it was an intrusive impulse or urge and then trying to redirect to whatever you would be doing if you hadn't just had that urge, which is obviously very difficult. But yeah, the intrusive urges have always made me very uncomfortable, so I can relate to that. But I have gotten more desensitized to it over time. So I hope that helps, but I definitely can relate to that and having like intrusive urges that you don't want to follow. And then our last question, can OCD be treated by a counseling psychologist or only through a clinical psychologist? I'm getting treatment from the former. I don't personally know the difference between a counseling psychologist and a clinical psychologist, but there's counselors, there's social workers, psychologists, a lot of different types of providers can give OCD therapy. What's important is that you are in treatment with someone who really understands OCD, because sometimes treatment providers don't understand OCD and they actually can make it worse because they don't understand how they feed into it. Which is why OCD as a company is very important, because all of their therapists are trained in ERP, which is the gold standard treatment for OCD. So I would say it's not as important. I mean, it's important that they're credentialed, but what's important is that do they know ERP? Do they understand OCD and how it works? So hopefully that's helpful. But I will say I don't know the difference between counseling psychologists and clinical, so I can't speak to that exactly. And I think, so I've made it through all the questions and we are out of time, but thank you for joining me. And like I said, I run an OCD advocacy and recovery shop, or if you just want to keep following my advocacy and say hi, you can follow me at the handle that I have written down here at the octopus, and I'll type it in the comments in case people want to follow and check out the website. Okay. But it was so nice to meet you all, and I hope I see you on another live soon, and keep fighting OCD.